Welcome to Remix EQ Live, where we are amplifying equity with a remix of information, interviews, and inspiration. I'm your host, Dr. Erica Tate, and today I'm broadcasting live from Savannah, Georgia, where I live. For those joining us today, please drop a greeting of choice in the comments. Let us know where you are joining from and the equity driven work you do or aspire to do. And remember, Remix EQ Live is an experience that's meant to be shared. I encourage you to hit the share or invite buttons and bring along your people, your network, your family, your friends, your peeps to join our Remix EQ Live community today. This season, we are broadcasting live on LinkedIn and YouTube. We can now connect more broadly, growing our reach and building our learning community. And while those comments are flowing in and those invitations are flowing out, I want to remind you that Remix EQ Live offers us the opportunity to connect and build community with each other around the equity driven work being performed throughout the world. And we do this by centering the work. That is, our guests and viewers share examples of what they do in their role or position as a way to illustrate the innovative, effective, and meaningful ways they advance equity in the spaces in which they live, work, learn, or play. Throughout the show and in the comments, I invite you to also share what you do to make the world a more just place. This is the second episode of Remix EQ Live Season 7. And today I am interviewing not one, but two social justice warriors, Linda Jackson and Demetrius Geiger. Linda is the founder and CEO of the Association for Community Empowerment Solutions, also known as ACESWorld. Through her global nonprofit, Linda empowers individuals to achieve optimal health and well being through education, access to healthcare resources, and partnerships. Demetrius is the director of initiatives under the Equity and Impact Department at CHC, creating healthier communities. Through this national nonprofit, Demetrius helps organizations achieve their missions by bringing communities, nonprofits, and businesses together. I am honored to share the screen with these brilliant women and fierce advocates for women's health. Today, we are centering Black women in our conversation about HPV and cervical cancer prevention. We will listen and learn from Linda and Demetrius about how they remove barriers to HPV vaccination and cervical cancer prevention for Black women in Savannah and across the state of Georgia. Together, we will become informed and inspired by their advocacy, their partnerships, and of course, their pursuit to make the world a more just place. So, if you identify as a woman, know a woman, or were born of a woman, yes, everybody, tune in and let us begin this conversation for change. Welcome, Linda and Demetrius.
Thank you.
I'm so excited to have you on our show. And we're going to start with introductions. So, Linda, I invite you to introduce yourself. And as you do, please share 1 to 2 career or personal twists and turns that have led you to your current role.
Okay. So as Erica said, I'm Linda Jackson. I'm the founder and CEO of ACESWorld. I won't say the whole long name all over again. I would say that the direction that I am going in now is a result of something I did in 2016. I began a class in design partnership management and innovation with Middlebury Institute of International Studies. And then I was like, okay, well, I've done this class. What do I do next? And so I asked one of the instructors, and they're like, well, you don't have this, you don't have this criteria, credential. So just go to the hardest place you can find. And I did. I started emailing people, and I ended up going to Haiti to work. And certainly Haiti was then and is now a very challenging place. Even there in the time like of food, all kinds of things. But I journaled about it, and other people saw that work. And so because of the work I did in Haiti, I got an opportunity to go to Uganda and do additional work there. Got to, speak before the parliament, just so many opportunities, got to go on safari, but also got to hear from community about what their needs are. And we'll talk a little bit more, I guess, later about how that informs the work that I do now.
Ooh, thank you so much, Linda. I appreciate you sharing about your travels and your journaling as ways that have moved you into this space. Demetrius, I invite you to introduce yourself. And as you do, please share 1 to 2 career or personal twists and turns that have led you to your current role.
So hi, everyone. Again, Demetrius Geiger. As Dr. Tate mentioned, I'm the Director of Initiatives at CEC, Creating Healthy Communities. So I still feel like a newbie, but I'm early in my career development right now. But I earned my Master's of Public Health at Morehouse School of Medicine. But my path to public health wasn't always crystal clear. Initially, I aspired to be a physician. I'm a geek and nerd for the sciences. So I actually got a biology pre-med degree at Kennesaw State, but also through me seeing how, women were treated in my family, their health concerns. And then also I'm a nurturer when it comes to children, kids, and also pregnant people. And so I've had a couple of friends, they actually had teen pregnancies, and I was heavily involved, even though I was a teen myself, in caring for them. So with those things combined, me being the nerd in the sciences and also being that nurturer for women's health and maternal and child care, I aspired to be a physician, specifically obstetrician. In addition to that, growing up seeing firsthand of how our environments, so like the richness of our soil, right, that we're rooted in, can either nourish our growth or create the barriers to make it difficult to thrive, also led me to the public health avenue. But my switch from aspiring to be a physician to going strictly into public health also changed during COVID. I saw how that negatively impacted physicians in the space. And also I realized with exposure and age, right, that I know one of the golden jobs is to be a physician, but there are other ways you can actually impact the lives of community members, right, day to day, because we spend so much time outside of physician settings that we need to do the things on a day-to-day basis to make sure we empower our people, to make sure they are receiving compassionate and culturally congruent care, and also just being able to thrive in their daily lives. So that's one pivot in my career. And also I would say my journey to becoming into the role of in leadership at CEC is really personal because I joined CEC early in my postpartum phase, right? And so after giving birth to my son, I navigated postpartum recovery while confronting the realities of not having adequate maternity leave, lack of support, the pressures of just maintaining, financial and emotional stability. And so I tell my colleagues this all the time internally that my postpartum rage, which was valid, really propelled me to leave where I was at Morehouse School of Medicine, which wasn't bad at all because it was all community health driven, health equity driven, but really for me to ignite and get into a workspace that focused on maternal child health, which is one of my passions that I have along with women's health in general. So I would say those are 2 big twists and turns that led me to my role today. So
thank you.
I know that was a lot. Sorry, y'all.
No, it's wonderful. Thank you for sharing your story, and I appreciate you speaking about your how you view yourself as a nurturer and the care that you bring into your work, and also I don't know, the passion you have. We can see it light up on the screen. And so it's great. And I thank both of you for showing us different pathways into supporting and uplifting communities through public health and helping communities thrive. It's really important for us to see those very different pathways so people know you too can affect change. We have Ninrat Gopal. She's excited to be here, and she's joining from Georgia. Woo, woo, woo. Hello and welcome. For those who are just joining us, this is Remix EQ Live, and we are amplifying equity through a remix of information, interviews, and inspiration. And now that you've had the chance to meet or reconnect with Linda Jackson and Demetrius Geiger, I know you are inviting others to tune in. And of course, I invite you to interact with us. Post comments to say hello, like Ninwat just did. Ask questions, share examples, or any learnings that you have as we dive deep into this interview. You are part of our Remix EQ Live experience. Now we center the work. This is an opportunity for us to learn from Linda and Demetrius about how they make the world a more just place, specifically how they advance health equity and progress toward HPV and cervical cancer prevention among Black women locally in Savannah and across the state of Georgia. As I mentioned earlier, Linda and Demetrius are fierce advocates for women's health, which includes many, many topics. So before we spotlight HPV and cervical cancer prevention in this episode, I wanted to shine a light on their broader health equity efforts. Linda, as the founder and CEO of ACESWorld, how are you advancing health equity for Black girls and women globally and locally?
All right, so thank you, Dr. Tate. So for us, the work that we're doing now really focuses more locally in Savannah, but up until very recently, we worked more globally, and we do continue to support some of our global partners. I mentioned Uganda earlier, and I'll go back to that just briefly. When I was in Uganda, we began our work always in the same place, in the same way, and that is with a question: how can we help? And so when I was working with a group of teachers in rural Uganda and Kabarole, I asked the question, how can we help? And a male teacher said, we need pads for our girls. And it was just like, what? You know, it was like, I don't even understand this concept. And, you know, with more time and more learning that I spent there, I understood that access to menstrual hygiene management supplies and education is a barrier to girls and women in many parts of the world, probably in most parts of the world. So we've taken that learning and we've used that learning in Colombia, in Malawi, in Kenya, again in Uganda, and in Ghana, and worked with 3,000 girls in those countries to teach them how to make reusable sanitary pads from local materials. That was a project that was funded by the Obama Foundation. But for me, it was something that we could do that will change their lives forever, because they will never have this as a barrier again. For us here in Savannah, I think we have taken that learning that we had about understanding communities, and that communities are the best reservoir of knowledge about the community itself, and done a lot of listening. And some of that listening propelled us into the work, the other health equity work that we do. So we provide maternal resources for women on our website about nutrition, about how to navigate a doctor's appointment, and how about many different things. We also provide resources in both English and Spanish around health equity, some of the same issues. What do you do when your doctor's not listening? What do you say? How do you navigate that, especially here in Savannah, where the options to select another provider are extremely limited? And so beyond that, for those who maybe accessing the website is not the best way to get information, we also offer a workshop called How to Prepare for Unfair Healthcare. And so in that workshop, we do a lot of listening, but we also find that people who attend the workshop are kind of really good advocates for each other, like listening to how each of them has been able to overcome the challenges, and the opportunity for them to share is really important. And I think it also inspires me as well. So that's aside from the work that we do around HPV and cervical cancer, those are the basic projects that we work on around health equity. And I'll just mention one more. We also do a project around climate change. And I'm going to say in Savannah, we changed the word climate change to extreme weather just to make people more open to the conversation, but supporting adolescents and helping them understand, become more resilient, as they are frequently exposed in coastal Georgia to many types of extreme weather, whether it's hurricanes, flooding, and certainly extreme heat.
Thank you so much, Linda, for sharing all that you do. I told you. It's so many projects that are really meaningful. And I appreciate that you start your projects with the question, like, how can we help you when interfacing with communities, or how can we help? And I think that's such a great takeaway for how to work with communities to improve health outcomes with them. And so thank you. All right, Demetrius. As the Director of Initiatives under the Equity and Impact Department at CHC, creating healthier communities, how are you advancing health equity and Black women's health in the U.S. and across the state of Georgia?
So in my role as a Director of Initiatives, like you mentioned, under the Equity and Impact Department, my role is really to ensure that health equity is an active, community-driven effort through multiple partnerships and coalition building to improve health outcomes on the various health topics that we focus on. And like Linda mentioned, like, we also hone in on what the community needs are. Of course, like, they know the solutions best, but my department, we do apply an equity and justice-based and social impact approach to all the work that we do, meaning we work alongside community. So to reduce those systemic barriers and also to strengthen the community-based organizations, we convene diverse stakeholders, and then also we mobilize those resources that are needed to really dismantle or decrease those health disparities. And the key 4 pillars I would like to amplify on this platform today is that our department, we do operate under 4 pillars for our programming, which is being community informed and led. So we listen first, just like Linda mentioned. We're evidence-based and informed. We're fidelity focused and also equity centered, as I mentioned. So we also operate several initiatives that advance health equity and also Black women's health. And so the first in our flagship initiative actually is the Black Birthing Initiative, where we aim to reduce preterm birth factors by addressing stress, medical racism, and also unmet social determinants of health needs that impact Black birthing people. So the way the BBI operates is the collaborative approach. And so right now it's operating in Atlanta. We work with Healthy Mother, Healthy Babies in the Centers of Black Women Wellness, also Cleveland, so Birthing Beautiful Communities, and the Village of Healing Center, which is a midwifery site standalone from the hospital, and also Detroit, which we work with a healthcare system. So they have Women Inspired Neighborhood Network, who's affiliated with the Henry Ford Health System. So this is a collaborative approach, and really what the mamas are getting, they're connected with doulas from the early stages of pregnancy, and that doula is with them through 6 core elements that I won't dive into today because that's a whole nother topic in itself. So that's a flagship initiative. And then secondly, we have the Breast and Cervical Cancer Initiative, where we're working to reduce the barriers, whether social and structural, to increase early detection, screening among Black and Latinx communities in Metro Atlanta. So we're looking at the cancer care continuum. So we start from prevention and we go all the way through survivorship. So not just treatment, but through survivorship, because there's a lot of trauma and things that come up after receiving a cancer diagnosis. And then lastly, we'll talk about this more in depth here, is a Vaccination Equity Initiative operating currently in Macon, Augusta, Savannah, and the surrounding areas, where we're increasing the demand for HPV. So I'll stop there. That's a lot. But those are like the other initiatives and ways that we are truly advancing health equity at CHC.
Thank you so much for sharing that. And we love that it's a lot, right? It's important work that needs to be done. And I appreciate you also sharing the pillars that you operate under. So I think it makes visible like what it is that you're considering when doing that work. And also like the community informed and community driven approach. I think, just to preview, you will hear these themes continue from both Linda and Demetrius about listening and working alongside community. But I think this emphasis really shows how important that is to working with communities and trying to increase or improve health outcomes. So thank you so much for sharing. All right, so we're going to continue to center our work, but now we will bring into focus our health equity lens on HPV and cervical cancer prevention. We will center the experiences of Black women, and we will locate our conversation on the local and state levels. So just to provide context for the rest of our discussion, and we'll start with you, Linda. And I'd love for you to define cervical cancer for us, and then also explain why you're working towards cervical cancer prevention among Black women in Savannah, Georgia.
Okay. So thank you, Dr. Tate. So happy to do that. So I think in terms of defining cervical cancer, not exactly sure that I will take that fully on, but what I will say is that cervical cancer is a type of cancer that we have a vaccination that can prevent it. It's a type of cancer that is actually relatively treatable if diagnosed early, and women have access to quality care. So I think those factors form the basis of the work that we're doing with the support of CHC. So I'll start with kind of what inspires me here in Georgia, more specifically in Savannah, to do the work, and how we've been able to take data and use that data to target the work that we do to specific communities where that are most impacted. So this would be a good time for us to see the map. And so this is a map that we were able to work with the Coastal Health Department to develop when we were working to understand what it is we needed to do. And if you look at on the left, there's a legend. The legend here represents the number of years of potential life lost related to cervical cancer. Although this map is a 2023 map, I just spoke with the health department recently, and there's been very little change for 2024. So looking at those areas where the colors are darkest are the areas that are most negatively impacted in terms of years of potential life lost. Some of those areas, or at least a couple of those areas, are actually within the city of Savannah. But the impact of that there are women there who live in those communities that are losing up to 44 years of their lives as a result of cervical cancer, when this is something that we know how to prevent and we know how to treat effectively, is the focus of what we're doing. And I think when you go from that, the kind of the next thing is, well, why? And that is where we began our work, supported by CHC, looking at why do these things happen? And talking to more than 100 women that we've done so far in the community to understand what is happening, we learned that it's almost exclusively a result of lack of knowledge. Certainly, there are those social determinants of health that are factors, but in having conversations with women, most women that we spoke to, or almost all of the women we spoke to actually, didn't have any understanding of the relationship between cervical cancer, HPV, and the strategies that they could use to protect themselves and their community. And I'll say that we focus our work on adult vaccinations, so we don't really focus much on vaccinating children, although that is very important. But we wanted to understand, like, what are the social and behavioral drivers of vaccine hesitancy in our community. And as we did that work, we found, well, you can't be hesitant if you don't even know that there's a vaccine available to help you protect yourself from cervical cancer. And when we looked at, okay, well, what are those hesitancies? We found, as I mentioned, the knowledge gap is number one. Misunderstanding about HPV, about cervical cancer, and that was something that was a problem across socioeconomic and educational levels. We also learned a bit about a financial barrier, but that's not a barrier as strong a barrier as the others. Another one is messaging. when we did a workshop, one of the women said I don't know if any of you have seen that commercial where the little kid has like the side hug for their mother, and it's an HPV vaccine commercial. She said, I didn't understand what that commercial was about, what it was saying. And so I think we, as a society, need to do better at messaging this in ways that people can understand. And I think the last one is really limited physician engagement. We find that neither primary care physicians nor OBGYNs are talking to their patients about HPV vaccination and the importance of that vaccination, even as adults, because I would say that many adults, probably 30 or up, did not receive or may not have received HPV vaccine as a child. And it is still available to women and men up to age 45 in consultation with their healthcare provider. So I think that's kind of a big piece, but I'll stop there. I know Demetrius has lots of really interesting things to add to this based on the work that CHC is doing as well.
Yes. Thank you so much for sharing both the local data resource, the years of potential life loss, which with us and having it focus on the local community. I think it's also a unique way of speaking about like death that can come from cervical cancer. Like how many years of your life are you losing for something that's preventable and can be treated? So I appreciate that and the hard work you did. It's always wonderful to see data driving community efforts. And also thank you for sharing those factors, like the misinformation, not understanding enough about it and how that is crossing like educational or social economic lines. And I appreciate the message. I appreciate the message on messaging, right? Because it's really important, especially when you're doing community work. How do you tailor that messaging so that people hear and take action on it? So yes, Savannah's so lucky to have you. Okay, Demetrius.
Yes.
I'm singing today. I don't know, but will you explain HPV and how your work toward HPV vaccine equity contributes to cervical cancer prevention?
Yes, I will do that. Okay, so the human papillomavirus, which is known as HPV, but want to give you the formal name, is one of the most common viral infections, and it is spread through skin to skin or skin to mucosa. So that's really intimate contact is what I'll say here. And about 80 million Americans are impacted with 14 million new cases current each year. So that is a lot. And Black women, since we're centering the work here, Black women we have higher rates of HPV positivity. So if you want to think about the ratio, that Black women are 1.5 to twice as likely to be positive for HPV. So centering the work again. So HPV is responsible for about 91% of cervical cancers and also about 70% of head, neck, and throat cancer. So I want to frame that, even though we're talking about women, that it's also important to mention that HPV does impact men as well, because we need to mention that. It's very key. But the good news is, like Lena mentioned, there is a vaccine for it that can prevent up to 90% of HPV-related cancers. And you can get that vaccination as early as 9. It's recommended between 9 and 26, but like Linda mentioned, you can get it later in age. So up to 45, consult your physician, talk about it, get the education to make that informed decision. But the issue is that leads us to the discussion of vaccination equity is that not everyone has equitable access to this key prevention tool. Given the numbers, the statistics that Linda just shared, is life-saving. And so because of that, we have the Vaccination Equity Initiative, where we are focusing on ensuring, specifically for Macon, Augusta, Savannah, and the surrounding areas, that we do provide that education, that knowledge, increase our outreach, change the messaging, and also get folks the resources and, reduce those costs or also make it free to get vaccinated. I know we're focusing on Black women, but with our partners, we also focus on youth as well. So making sure that specifically for cervical cancer, we are dispelling the myths about the vaccine, reducing those barriers, like I mentioned, to cost, actually linking them to healthcare providers, and also bringing the vaccines to communities. So whether that's a vaccination pop-up at a college campus, things of that sort. And so, thus far with the VEI, we have resulted in over 10,000 HPV vaccination referrals. Working on seeing how many actually got vaccinated, but hey, referral is the first step, right? More than 100 community outreach efforts. And then also training is a big part of this, where youth have been trained through one of our partners. Health educators are being trained about it. And then also community health advocates or champions to make sure we're increasing that awareness in the community. So I'll stop there.
Yeah. No, thank you for also sharing like what are barriers to vaccines. I think you mentioned like cost, transportation, well, which you're addressing by bringing the vaccines to the communities, and then just the referrals, right? Having that. And I love that youth and community members are like ambassadors for that. They're being educated and being able to help share the word or spread the word. So thank you. And so on our health topics, it's really important that we like share the facts so that we are not part of misinformation, but part of empowering knowledge. And so helping people to consider the importance and impact of HPV and cervical cancer, and then the steps that it takes to prevent and treat it. So I appreciate you all making that clear and making that very urgent and important for those listening today. Okay, so we would like to now like just add examples and strategies and tools like to our repertoire, right? As social justice warriors, like what are you doing to make this important work happen? So we've heard a lot about the work that you're doing, but just sharing some examples I think will be helpful for those who are local, right? And may want to connect to work that in the places that you mentioned, but also if you're in another place and you want to bring this type of work to your community, here's some examples of the types of steps that have been taken. So Linda, what approaches or strategies have you implemented to engage local Black women in your HPV and cervical cancer prevention efforts?
Okay, so thank you. So we have, at this point, we have 3 that we're working on. The first one is called Path to Prevention, and it is a role-playing card game that we've developed that we are going to be sending the cards to different communities, hopefully putting them in community centers and other places where women and men, for that matter, can understand how they can become advocates by helping people overcome barriers to both screening and vaccination. The second is that we are almost finished our HPV decision tool. This is an app that will allow a person basically to define who they want to get information about. So myself, my children, and then through a series of questions, be given small pieces of information that will help them make an informed decision about accessing HPV vaccine. And then the last and kind of our biggest project that we're doing is the Empower Her Health Festival. This is May 17th, and we're really, really excited about it because we feel that so many times Black women, I feel like we're often the ones who are carrying the barrier of I'll call the weight of our family, our community. And so this is an event where we want to give women information, but we also want to uplift and honor them. So while we will be educating them around issues for cervical cancer prevention, for HPV vaccination, and hopefully improving their uptake of HPV vaccine, we also want to honor them because our strategy is that when we honor these women, we make them more open to new information and new learning. So those are the principal things that we will be working on moving forward. And we're really, really excited because we're like the out of the box organization. Like if everybody's doing something else, but almost like, well, wait, we're not doing any of the things that other people are doing, but that's always been who we are as an organization. Like, how can we find a different way? We know that many of the strategies that others are using are effective, but we also know that we're not yet making a really big dent in HPV vaccine uptake in the US. And so any strategy that we can help develop that might put just a little tiny additional dent in that is something that we're really excited about having the opportunity to do. So I'll stop there.
All right. Oh, thank you.
Go ahead.
Were you gonna say something to me?
Yeah, I was, because okay, so I just love our partnership with ACESWorld, because it is so true. Like, we really need to be innovative in our ways and how we, message and package things, because we know in today's time, there's so many different avenues that are catching folks' attention, but it needs to be in creativity. So I really do appreciate everything that you're doing, Lita. So I just wanted to uplift that moment here.
Thank you.
You guys are so uplifting. It's so wonderful. Thank you. Yes. And it is true. Linda is definitely innovative. She's always, when I meet her outside of the screen, okay, she is always coming up with different tools and apps and different ways to really engage people's thinking and planning as it relates to their health. And so I'm not surprised that you have a card playing game to really help educate youth, and that you're going to put them in community centers. I mean, it's great. And I think it's that type of innovative thinking, right, that changes the messaging and changes the tone and provides the resources for communities. So I appreciate that. And also, I just want to make sure, I got you, Renita. But do sign up for ACESWorld's Empower Her Festival, or nominate women for that. It's wonderful to be a part of something that's not only educating, but really uplifting the role that Black women can play in HPV and cervical cancer prevention for themselves and their families. And thank you, Renita Kibuka. Yes, she says, great and informative discussion. It is, isn't it? There is work to do. Yes, and you have role models right here. And she loves the term social justice warriors. Yes, because that's exactly who they are. So now it's our term. So, Demetrius, on the state level, how have you convened key partners in working toward HPV and cervical cancer prevention?
Yes, I'll frame it in how CHC convenes partners. So a key strategy for us, especially for any initiative, but for the BEI to frame the work here and center the work, has been initially building partnerships with various organizations like ACESWorld, deeply rooted in cervical cancer prevention, HPV awareness, and also vaccination equity across Georgia. So our approach isn't just about increasing access to HPV vaccination, but also fostering the trust and creating sustainable linkages of care to drive, meaningful community engagement. So that's our role at CHC. And in this opportunity, in this work, we awarded 6 incredible organizations to work directly in communities to build HPV, the demand for HPV vaccination, and also cervical cancer prevention. And so together, we are creating community responsive awareness campaigns, and to make sure those strategies are culturally relevant so we can increase that uptake of HPV vaccinations. And so I want to name all our partners because it's very key, because partnerships are at the heart of what we do. So East Georgia Cancer Coalition, they are focused broadly. However, they do really focus on the college campus aspects of getting the vaccinations to them. We also work Georgia Campaign for Adolescents' Power and Potential, a mouthful, I know, but they are really into educating and empower the youth to make informed decisions. We have Healthy Savannah, which is local contacts, and you're familiar with them, Dr. Tate, and also Linda, of Healthy Savannah. They have the community health advocates really in the community, increasing that awareness and creating those direct linkages of care and referrals. We also have the last 3 we recently funded, including ACESWorld, to do the vaccination equity rapid response. So they have these mini grants to really support one event or a series of close events to amplify HPV prevention. And so the Susie Jolin Foundation, we're working with them. They're really in that policy space. We have Grow Initiative Georgia, which really focuses on the Spanish community. And then we have ACESWorld. So in addition to funding those organizations, we also established a community advisory community, which is very pivotal to ensure that our work at CHC and also with the partners, that we are aligned with the needs and the priorities of the community. So they are a pivotal process of planning all the way through evaluation with our work. So, and then also recently we had a convening. So we brought all our partners together, and also the HPV work group in Athens, Georgia, just, what was it, last week? February the 4th. And so we intentionally planned that around the Georgia Cancer Summit, which was the day before, so we can integrate the recent learnings from that summit into what we're doing. So we had a powerful discussion and we shared our progress, exchanged insight, and then we also had the opportunity to strategize on future efforts to close that vaccination equity gap. And so, yes, I'll stop there.
I know we need like a whole 2-hour panel. I love it. Thank you so much for sharing, and I appreciate you naming your key partners. Right, that relationship's really important, but also there might be a partner that's near someone who's watching, and hey, you could join in on the work. So I appreciate it. So I just want to make sure, like, if you haven't picked up on it yet, Linda and Demetrius are an example of funder-grantee relationship. So CHC Creating Healthier Communities is funding ACESWorld's work around HPV and cervical cancer prevention in Savannah. And I just think it's not often that we're able to bear witness to conversations between funders and grantees. And so I wanted to make sure that we could just add any insights or gain any insights from them as it pertains to a funder-grantee relationship that is focused on community work. And so, Demetrius, in addition to funding, of course, how do you work with grantees to support and uplift their work in their communities?
So, which is very key. Thank you, Dr. Tate. So, of course, beyond awarding grants, CEC role is to really listen, support, and enable our partners to, do their work directly in the community. So, providing that extra support. We work with our grantee partners to strengthen their impact, right? We do this through co-creating and amplifying their work. So, co-creating material, sharing insights, and also being involved in any additional developments like leveraging funding, right? And also showcasing any storytelling and their impact. We also provide ongoing capacity building and technical assistance on a tailored basis. So if Linda comes with us and there's a challenge, we're going in with them on the ground. Let's get it going. Let's figure it out. Like, we're working hand in hand. We are not a hands-off funder. We don't do that. That's not how we operate. We want to make sure that everyone's achieving at their maximum capacity with this initiative. And then also we do foster partnerships and other networks. So whatever comes up, like if there's a challenge or we know there's another partner, whether they're local or not, or maybe adjacent, we want to make sure we strengthen their network. So we do forge partnerships. And then lastly, we build these like learning communities. So collaboration fuels innovation, right, Linda? So we really do prioritize silo busting. So that's why we focus on bringing the grantees together to do that cross learning among each other, to share their learnings, best practices, and also collective problem solving to do that. So that's really how we frame our grantee funder relationship.
Perfect. Thank you so much. I appreciate you sharing those like key ideas, and I really hear the collaborative spirit, right?
Yes.
That you're saying, and also like how it's a learning experience, both from you learning from the grantees and grantees learning from each other. So thank you so much for sharing. I just wanted to open it up to Linda, if you have an example of how CHC has helped your work here in Savannah with regard to HPV and cervical cancer prevention.
Well, certainly I would say the biggest thing is being able to attend the convening last week. There's so many things that we don't directly do, but that we can share with the community that may help other organizations in the work they do. And I think the biggest issue that we don't generally work in the advocacy space, but there was a lot that we learned about advocacy during the convening and how we can bring to bear our communities to assist in advocacy issues, especially around legislation related to HPV vaccine. And so I think that was one of the takeaways. And there were certainly many opportunities for learning just more about HPV, more about cervical cancer. I think there was one of my takeaways was really more about the impact of cervical cancer, about HPV related cancers on men, specifically African-American men. So we have the opportunity to participate at the 100 Black Men Health Fair this weekend. So this is another opportunity for us to bring light to throat and neck cancers. But realistically, most women contract HPV from men. So engaging them is really, really important. But also, before we run out of time, would you mention this? And I would like to say, so I invite everyone to use the QR code to nominate women in your community who you think deserve the opportunity, which I think is all women, deserve the opportunity to be a part of this learning event. And we are so excited to be able to do this. We can't wait to get in the room with women, because I believe so much happens in the room, and so often we're not in the room. So I think those are my big takeaways, and you can feel the love fest between ACESWorld and CHC.
Which is apt on this Valentine's Day.
Dr. Tate. Oh, this is fabulous. Okay, so.
Oh, I love it. Thank you so much for sharing and letting us like peek into your relationship. And I love that Linda walks away from the convening like, I have another partner that I need to bring in and show up. It makes me so happy. Well, we're starting to come to a close. But this was a jam-packed, full information-filled show, which I knew it was going to be. And as you know, every guest on our show drops knowledge, which you guys have done, and drops inspiration, which I know everyone can feel throughout the show as they share. And you guys have done just that. You showed us what it means to center, support, and uplift Black women, both in your work with HPV and cervical cancer prevention, but in your work with each other as funders and grantees and really advocates for women's health. So I appreciate it. And I just need you to drop one last piece of inspiration on us. So Linda and Demetrius, you get the same question. As you reflect on your roles in HPV and cervical cancer prevention among Black women in Savannah and across the state of Georgia, what are you most inspired by? And how is that inspiration influencing your next steps? Okay. So we can start with Linda.
Okay. So I think I'm most inspired by how open women are that I speak with about learning about HPV and cervical cancer. And although they may not be completely sold on the HPV vaccine, the fact that we're starting the conversation, that they're understanding why it's important, that is what inspires me. I think when I started, there was like this issue around vaccine hesitancy, and I'm like, okay, maybe, but let's talk. You know, you can't hesitate to get a vaccine that you don't even know the importance of, or you don't know it exists. So this opportunity to have these conversations with women and their openness to learning is something that actually it inspires me in every work that I've ever done. So
thank you. And Demetrius.
It's honestly echoing what Linda said. Like, honestly, what inspires me is I see so many women taking more control over their health. And so I just see that I'm really inspired by our persistence as Black women in power and our collective will to take autonomy over our life and our health. And so, and another thing that helps me with that inspiration is I'm looking forward to shifting that conversation around cervical cancer. I know it's still stigmatized. Actually, in November, I led a focus group, and it's just, I'm so looking forward to creating a paradigm shift around how we approach and discuss HPV and cervical cancer and vaccination equity. So that is what I'm inspired by. And also the convening left me reinvigorated to push forward and really focus on the male aspects too, Linda. So we'll definitely loop you in once that concept is finished. But yes, that's my inspiration right now.
Oh, well, thank you so much for sharing your knowledge, sharing your information. Linda Jackson, Demetrius Geiger, thank you for accepting my invitation to speak about what matters most to you. And I'm grateful for the opportunity to listen and learn from you, especially about how and why you make the world a more just place. So thank you.
Thank you.
You're welcome. Oh, please come back again. I just have a few announcements before we wrap up, and then we'll head off on our Valentine's Day weekend. So just a reminder, we're here on the 2nd and 4th Fridays at 11:30 a.m. Eastern. We'll be back on February 28th And I'll be in conversation with Dr. Stephanie Wood-Garnett and Asia Lyons. Dr. Wood-Garnett is the president and CEO of Women of Color Education Collaborative, which is a nonprofit that seeks to increase the number of women of color who positively progress and thrive in K through 12 system leadership roles through leadership development that elevates executive skills, fosters meaningful connections among participants, and promotes self-care and wellness strategies. And Dr. Asia is the CEO of Lyons Educational Consulting and is deeply committed to her mission of co-creating truly inclusive environments designed to empower Black educators and foster their self-actualization through wellness initiatives. So yes, we're centering Black women educators, career growth, and their wellness. So tune in on LinkedIn and YouTube, and also like and share our upcoming and past shows, and subscribe to our YouTube channel. And now that we are in season 7, I just want to remind you that we have created a substantial and I believe inspirational body of work. We have nearly 50 episodes, which have been curated in different playlists for your viewing and listening pleasure. So if you like today's show, be sure to check out our following Remix EQ Live playlists on the Blue Knowledge YouTube channel, our Health Equity playlist, and our Savannah 912 playlist, which features local Savannahans who are working to make the world a more just place. I invite you to view my recent TEDx talk, Building Community to Make a World a More Just Place, which is inspired by my experiences here on Remix EQ Live with guests and you. And you can also visit our Remix EQ Live, a webpage. We have episode announcements, recording, information about inspiring guests, just like Linda and Demetrius. And we also have new ways for you to discover how to support our Remix EQ community through donation or love offerings. And also we have some merch like t-shirts, message tees, and our Empower and our Amplify notebooks for you to take notes because everybody's dropping so much knowledge. And then while you're on the show's webpage, or if you are engaging in a bit of justice-inspired retail therapy, please poke around the website and learn more about my business, Blue Knowledge, which advances equity in schools and communities through collaborative research, inclusive evaluation, and equity-driven professional and community learning. You can follow us on LinkedIn. You can follow us on the Blue Knowledge YouTube channel. And of course, you can subscribe to our newsletter. And if you are in the Savannah streets, we can always connect as well as the digital streets. Thank you, Remix EQ community, for your engagement, your encouragement, and your rally, which is how we recognize, appreciate, learn, love, and take care of you as you work to make the world a more just place. I'm your host, Dr. Erica Tate, and this is Remix EQ Live. See you next time.